huge rise in diabetes is threatening to bankrupt the NHS, according to a charity. More than 3 million people in the UK have been diagnosed with the condition. That's an increase of 60% in the past decade. Many of the cases are linked to obesity. Here's our health correspondent Dominic Hughes.
This is the human cost of diabetes. A below-the-knee amputation has left Robert Carew-Hunt struggling with everyday life. Each week, more than 130 people in the UK undergo an amputation because of complications with diabetes.
I was eating loads of crisps, biscuits, cakes, sugary drinks. It has gradually reduced the quality of my life. It's made me less mobile. I've been in constant pain.
Diabetes patients can't control the level of sugar in their blood and can lead to nerve damage and blindness. Type 1 diabetes is most often diagnosed in children who can't produce the hormone insulin, but around 90% of patients have type 2 diabetes, closely linked to obesity and mostly avoidable. And it's placing an increasing financial burden on the health service. In England alone, medication for diabetes now costs £869 million every year. That's 10% of the entire NHS drugs bill. And that's just a fraction of the total £10 billion it spends each year dealing with diabetes.
We've sleepwalked into what is a crisis. It's crazy to keep spending money on treating the end stages of diabetes when that money spent at the early stage in helping people live healthily would be much more productive.
Medical staff are now much more aware of the need to check for the danger signs of diabetes, and that might account for some of the rise we've seen over the past decade. But by far and away the biggest risk factor for type 2 diabetes, which make up the bulk of the cases, is lifestyle and obesity. Diabetes UK says better prevention and treatment could save the NHS huge sums of money and improve the lives of those like Robert living with an avoidable condition. Dominic Hughes, BBC News.